Hi, it's Dr. Allen, and although this video is under 5 minutes long, what you're going to hear is going to change how you market your practice, or at least it should. I want you to listen to what these experts are saying. It is what I have been saying for years, but you need to hear it from them.
So one of the things we talked about is patient education. And first of all, just kind of how wrong that term has been over the years. I think, Guy, that's probably a great one for you, because we've used that term for so long. How do you feel about patient education?
Well, one, it has to happen, but two, the concept of it is totally wrong, because it implies that a person doesn't know anything, we're going to tell them something, they're going to have a revelation and their epiphany, and they're going to get started under care. When in actual fact, we found out that people are already in our belief systems. They already own our ideas of vitalism. The body is a self-developing, self-healing, self-maintaining mechanism. And they're looking for skill sets on how to do that. I remember when we were building a building at Life, we had an architect, and his wife had a serious healthcare problem. And she decided, it wasn't acute, but it was serious. And she decided that she wasn't going to do the medical route. So she went to a naturopath, and they did the normal stuff, took some blood work, cleaned up her nutrition. Along the way, the naturopath said, well, we ought to include chiropractic in this too. So she went to a chiropractor, and chiropractor did what we do, 3 times a week and all that kind of stuff. And then the chiropractor said, you ought to include this. And so over a period of 2 years, she actually built a team to help her get that accomplished. In medicine, if you walk in a hospital, the whole team is there. They move you around. They don't even ask. But we've got to, as chiropractors, find a way of taking people that already believe the principles that we believe in, simply identify ourselves in that, and usually we'll be identified as the leaders in it and start helping people put these teams together. Right. So it's less about patient education these days and more about modeling information that someone can attach to that already has a belief about what we do.
I love it.
Modeling information. In other words, make yourself a source of everything health that they can identify with. So let us first talk about what they are not saying. This is not about sending emails every day or multiple times per week, whether automatically or not, about a discount coupon for their friends and family. It is not about discrediting another healthcare or sick care model. They're doing a good enough job on their own to make you look better. It is not using bridal showers or Groupon discounts to bait and switch people. By now you should know people don't come to you because you're giving away your services. It's about providing great health information that aligns with what they already believe, giving them the confidence that you are the person that is best able to help them with their health choices and decisions. Now let's listen to what an expert in patient communication says.
So let's just talk about the 800-pound gorilla that is in most chiropractic offices that's virtually ignored. And that's the belief that if you make an assertion or declaration, you've educated the patient. Whether you're at the X-ray view box yakking away, whether you are table talking where the patient's face is wedged in headrest paper and you can't see their eyes roll as you talk about the topic of the day, and you force feed them some chiroism that is top of mind today. That is not patient education. Never was patient education. If anything, it's a wimpy form of patient teaching. And the problem is that those sorts of overtures are so easy to rebuff. You just feign interest, you nod your head at the right time, and the doctor continues to yak on, and he or she thinks that they're doing something, but what they're really doing is annoying the patient.
So how do you educate patients to keep the conversation going, model the information they already identify with, motivate them, and make yourself a source of everything health? Here is how we do it for our system clients. First, we build credibility by using video press releases for our chiropractic clients and also our MT and FDN clients. Here is a chiropractic sample.
Welcome to another Health News video news release brought to you by HealthNews. Recent studies show chiropractic care can help treat children with ear infections as a safer and more effective alternative to the more aggressive medical protocol that requires antibiotics and surgery, which carry risks and undesired side effects.
Our team of health experts pour through the medical literature and look over 100,000 peer-reviewed articles a year to provide recommendations based on science, not conjecture or urban myth. Then our health expert writers, a team of chiropractors, naturopaths, MDs, dietitians, nutritionists, and other health professionals craft the research into content for your patients. We then deliver that content to you every week, and you can see the latest articles we created for you scrolling behind me just from the last couple of months. Now, you could use that content with the video blog we give you. We even teach you how to make the videos. Why video? Because that's what works. Then the video is distributed automatically to your website, the mobile apps we build for you, the email account we give you, and out to all your patients automatically and to the social networks. There are tons of patients that have the same mindset as you, but unfortunately, unless you are a system client, they don't know you exist. Why not give me a call at the number you see on the screen, and let's give your marketing the professional touch it needs. I'm Dr. Allen, and I look forward to speaking with you soon. Have a great day.